Good evening, everybody. Thank you so much for joining us tonight as we're going to talk about careers in public health and epidemiology and biostatistics. We have a full agenda tonight. I do want to make a few notes that I put in the chat box that we are recording this. We will share the recording out with all of our participants. And also, if you have questions throughout the presentation, please put them in the chat box. I'll do my best to keep an eye on the questions and ask our panelists throughout the presentation, and we'll have plenty of time at the end to make sure we capture those questions. So we're going to get started. I'll do brief introductions. We're going to talk about what is epidemiology and biostatistics, career opportunities in public health. As you can imagine, the field of public health has had a lot of attention in the last year. So what are the different career opportunities in public health and how do you get there? What is our Master of Public Health program at the University of Vermont? And there's a lot of questions that prospective MPH students ask, and one of our advisors will guide us through some of the top questions that students ask as they're considering the program. And just a few slides that we have on the application process if you are interested in UVM's Master of Public Health program. So welcome, everyone. My name is Nicole Willier-Fenton. I'm the Content Marketing Manager in UVM's Continuing and Distance Education. I'll be facilitating our discussion tonight. With us is Dr. Victoria Hart. Vicki Hart is one of our assistant professors in Larner College of Medicine in our public health program. You can see her background here from the University of Massachusetts and University of Vermont, as well as Cornell, and she focuses in on epi and biostat. So we'll hear a lot more from Dr. Hart tonight. Also joining us is Heidi Westerman, one of also our faculty on our program, a clinical instructor. She's part-time faculty because she is a full-time employee in the health world here in Vermont, and she will talk to us about some of her work that she has done in health. She is now the Director of Public Health Systems and Planning for the Association of State and Territorial Health Officials, and the former Director of Performance Management at the Vermont Department of Health, in addition to being a public health analyst at the Department of Health, and you can see her credentials there as well. Heidi, thank you so much for being with us. And Vika Pleshakova is with us as well. Vika is our advisor. She works so closely with our public health students. She's going to be the one helping us to guide that process if you are interested in the Master of Public Health program here at the University of Vermont. Okay, so let's get going. I wanted to start first by a few definitions. We're going to learn a little bit more about epidemiology and biostatistics. So let's start with Dr. Hart first. What is epi? I think it's probably got the most attention that it's had ever in the past year, potentially. So walk us through this field, and we'll go behind the curtain a little bit to really understand what epidemiologists do.
Sure, absolutely. It's great to be here and to be able to talk about epi and biostats today. You talked about the pandemic, and I think this is the first time in my whole career when I've introduced myself as an epidemiologist that people are like, oh, okay, I know what that is now. It used to be all kinds of questioning looks. So epidemiology at its very core is the study of the cause and spread of disease. So it's all of these rigorous scientific methods that go into figuring out what are risk factors, what's causing disease, and then how is it spreading among our population. And there's kind of two ways that you can approach this. And epidemiologists, depending on your specialty, come at it from different ways. And one is reacting to disease outbreaks. And the coronavirus pandemic is a great example of this. So when we first see a disease outbreak, epidemiologists are wondering, well, who is getting this disease? Where is it? How is it being transmitted? How fast is it being transmitted? And how can we really get our arms around this disease so that we can prevent the spread as much as possible? And with coronavirus, we pretty much know that everybody is everybody can get it. But epidemiologists have been on the front line identifying those vulnerable populations, the folks that we need to keep as safe as possible. And that's been the work during this pandemic and then trying to prevent the spread. And then the other way that epidemiologists come at population health is from a preventative mechanism. So proactively looking at those risk factors that may be involved in increased rates of disease development. So things like smoking, occupational hazards, all kinds of exposures that individuals can have that at a population level are increasing risks of certain diseases. So there's different ways that you can look at population health, and epidemiologists come from both sides.
Many people probably have seen, I think it was Contagion, the movie that you have shown us many times. It's very Hollywood, of course, but there's probably some truth into the kind of work that those disease detectives are doing. Walk us through a little bit more, and Heidi, I'd love to hear from you too, in terms of how you're applying epidemiology to the work that you're doing. And I know you're deep into the vaccine rollout as well, but what is a disease detective?
That's a great question. So I've worked in a few different spots in epidemiology. I've worked in HIV surveillance in the New York City Department of Health. I've done tobacco-related epidemiology in Vermont. And as you said, right now I'm doing some vaccine rollout. And all of that is thinking about where the people are. When are they? Where are they? When are they? And how many are they, right? So we're looking at person, place, and time. And sort of piecing that puzzle together is why disease detectives is so often used as a sort of pseudonym for epidemiologists. And if I'm thinking back to some examples when I worked in New York City, we know pretty well who has HIV in New York City. There's some of the best reporting and surveillance systems in the world to track that and to do it in a ethical and data sensitive way. But when we really want to apply interventions to that, looking at that data and saying, okay, are there certain zip codes or census tracts where we are seeing patterns? Is there access to care for those folks? So really, it's the epidemiologists who are providing data to our clinical partners, our pharmacy partners, our laboratory partners. And together, that's creating public health strategies and solutions to maybe mitigate some of the negative impacts of disease on populations.
Dr. Hart, did you want to add anything to that? Because I know the two of you could probably talk about this all evening.
I think we certainly could. The piece I want to add to it is, I think, a piece that sometimes gets lost in epidemiology, which is epidemiologic methods are really the backbone of all of this research. So as we're looking at population health, it's very different from lab science. And a lot of times we're observing people's behavior. We can't control it, but we're observing what they're doing, what happens, what might be putting them at risk. And that means that our studies are very susceptible to bias. Who is involved? Who can we get data from? How can we get their data? A lot of times our data is self-reported from individuals, so there's biases associated with that. And the epidemiologic methods that we learn and that we talk about and that we employ are really designed to create the most scientific, rigorous, and evidence-based results that we can get so that we can put interventions in place and get the outcomes that we hope to get. So it's really a very methods-driven field in this pursuit of better population health and understanding disease and the spread of disease.
Great, thank you for sharing that information too. And I think especially when thinking of the vaccine rollout that Heidi's doing, the education and communication component to that, I'm sure, is paramount to being successful. Epidemiologists, I think between the two of you, you've listed a lot of different things from the academic side to in practice in a variety of different roles that we saw back on Heidi's slide. Maybe we'll go back to you, Heidi. Walk us through your path a little bit in terms of what kinds of different roles have you been able to seek as an epidemiologist in this field?
Yeah, happy to answer that. So I'm definitely trained as an epidemiologist, and that's my core, but I am a generalist. I really love all topics in public health. And because I am comfortable with numbers and using numbers to inform decision-making, I've actually worked from a more narrow role, being a sort of a direct analyst, using SAS or SPSS or Stata or some of our statistical software to really analyze data sets. And that is a core, if I didn't know how to do that, that would be a loss to me and I think the field. That's really where I started and where you gain a lot of skills in a program like UVM's MPH program, some of those basic biostatistics. But that can expand. And for me, that is what happened, right? I started working a little bit more in program evaluation and performance management. And that means not just looking at population health data, but also looking at how effective are our public health programs. And so today I am actually by some terms, a supply chain logistics manager, and I can tell you where every dose of every vaccine is in the state across multiple pharmacies and hospitals. That's not epidemiology, but like my comfort and my understanding of the geography of Vermont, of the partners, and of timing and sequencing are all epi skills that I was able to apply to vaccine implementation. Never in a million years would I have imagined that, but it did, looking back, it's sort of a logical progression, especially for someone like me who is a generalist who enjoys multiple public health topics and is willing to kind of look across systems for patterns.
Wow, thank you so much for sharing that experience. Vicki, do you want to also just give a little bit of your perspective, because you teach in this field as well as working in the field?
Yeah, absolutely. Heidi said that she trained in epidemiology and that's where she started. And I have completely the opposite story. I trained in mechanical engineering because I like math and science. And if I'm 100% honest, I didn't really know that epidemiology and biostatistics in the field of public health existed when I was, going to my undergrad degree and trying to figure out what I wanted to do with my life. And I came to public health through statistics. I got really interested in manufacturing process control. I went back to school for statistics and took an epidemiology class. And so statistics became biostatistics, which then turns into my PhD in epidemiology. So I really come from a very quantitative background. And, like Heidi, my focus has expanded, but I've stayed very much in the methods and the stats realm. And that's really what I enjoy teaching. And then, I worked as an independent consultant for a while in biostatistics and study design. So helping public health organizations design studies to do good data-driven, evidence-based research, and then helping analyze those data. And as I was working with them and, teaching them some of these skills, I realized how much I enjoy teaching. And that's how I came to this position here in a teaching role with Epi and Biostats. But I still do a lot of work through my work here at UVM with rural health practices, working on research design. When they have a question, they want to know something about their patient population, and they have a question and want to figure out, can we do some research around this? Can we understand better what's going on? I can support them in designing a solid research study that will give them the data that they'll be able to take action on later down the road.
Which leads perfectly into the slide. As you started talking about biostatistics and the work that you do, I thought, well, let's touch on that. So we've defined epidemiology, looked at some of the different career paths and career opportunities and work that is done. But I feel like that biostatistics is almost the foundation of epi. You need to have, they work so well together. Can you maybe unpack that a little bit for us, Dr. Hart? And then Heidi, we'd love to hear from you, because you made a great comment earlier when we were just chatting amongst ourselves before we started that, embrace the enthusiasm towards math and statistics. So let's start with Vicki and then we'll go to Heidi next.
Sure. So, at the very basic level, biostatistics is statistical methods applied to medical and biological problems, and that includes public health. And as you said, it really is the foundation of a lot of the research that we do. But biostats would be nothing without epi, and epi would be nothing without biostats. So the way I often think about it is epidemiologists are designing the best studies that we possibly can. We're trying to minimize bias. We're trying to deal with confounding. We're trying to select the best populations that we can get really good data on in order to understand what's going on. And then once we get those data, the biostatisticians are applying the statistical techniques in order to analyze that and to give us results that we can interpret in the context of the study and of this population that we're trying to look at. But if the study wasn't designed well, the data will be meaningless. And if you've got a great study, but you can't analyze the data, you're going nowhere anyway. So really, biostats and epi are so closely linked, and biostatisticians need to be involved up front when we're looking at different public health implementation, and epidemiologists need to be helping to interpret the data on the back end because they understand the study and the research that's been done. So they're very closely related fields, I think. And yeah, I'll pass it over to Heidi because Heidi's really involved in surveillance, which is a lot of where we get are large amounts of public health data from. And that's a lot of what we use to analyze and really understand in large populations what's going on.
Yeah, thank you, Dr. Hart. So, surveillance is about counting. So when we talk about math, I learned how to do modeling. I think I wrote my MPH thesis on logistic regression. I do mostly addition and subtraction these days, and sometimes division, I will say. Sometimes we want to know the percent of the population that we've reached, or the proportion of, X, Y, or Z. But I think that comfort with the numbers and math is important. If that is not an area of comfort for you, perhaps public health policy or other areas of public health could be a good fit. But I want to stress that it is not calculus all the time, and it doesn't have to be. So I think there is a fit for many people in biostats and epi that as long as you have some, and you're sort of like, you care, like, what does the data tell us? If you're not wanting to make, I think there are a lot of us wanting to make data-driven decisions, especially in 2021 when we have big data, right? Amazon is making decisions based on data, and government, and we are. In fact, I'll share that Vermont's governor has been so data-driven in the COVID response that there's a daily dashboard with multiple statistics that come from a variety of public health data sources to inform the planning for COVID implementation. And so most of that data is counting, some addition, subtraction, and some proportions. It is not intense, although there have been some other efforts where there's been modeling and out and project where the epidemic is going to go, but also when are we going to be able to open up certain parts of the economy. So comfort with numbers is what I recommend. You don't have to love all of the intense high-level math, but I think there is a willingness to dig into the data and to understand its strengths and its limitations. That's a big part of both biostats and epi.
That's great feedback. Thank you both. And I think that's a great launching point to talk about what else can you do. We focused tonight on epidemiology and biostatistics, but and as you said too, Heidi, generalist. We'll talk about that in a second. How our program really helps graduates be a generalist in public health. But you can kind of weave in and out a lot of these other roles too. I've seen so many of our public health graduates morph into different roles, and even Heidi, your experience too, just looking at, as you were an analyst, and then you were directing, and now you're running, and now you're doing vaccine rollout. So I think it's really interesting, and this is a short list. I think the list could be really big as to public health careers, but maybe we'll go back to Vicki, and then Vika, I want to come to you because I know that you get this question a lot too, as to what can I do with public health. But Vicki, where do you see students go, and where do you see some good opportunities here?
One of the amazing things about public health is that it is so broad. I mean, it covers everything from policy to the quantitative sciences, but to the environment, to global health. All kinds of different careers can come out of a public health degree, depending on your interests and what you really want to do. One of the delights of teaching in this field is seeing where people come to public health from, because that's equally diverse. And so folks will come with a nursing background or with a medical background, and they may have different career goals than individuals who are coming in from more of a political science or a policy background versus anthropology. So there's a huge array of things that can be done. I've seen students, go into straight epidemiology roles in a Department of Health, that kind of thing, but also students stepping into other different roles in health data communication, or just health communication in general. Program evaluation is a really big field that, as we move forward, we've put all these wonderful public health interventions in place, but as Heidi alluded to a little bit earlier, how do we know that they're working? You need people being able to go in, understand the intervention, and be able to understand if it's doing what it said it was going to do in the first place. So that's an area in which you can use data skills. But on the policy side, there's all kinds of different field, and that's not my area of expertise, so I don't want to speak to it too much. But some of those listed on the slide here are excellent ways that you can get involved in health policy. And we know as a society that our health policies probably need to change quite a bit. So there's a lot of work to be done there by people who understand public health.
Great. Thank you for that perspective. I wanted to jump over to Vika as well, because one of the things that we love to talk about in the Master Public Health Program, UVM, is this slide, is the academic and career coaching, is the guidance that you provide to students, Vika, on what courses they should take, what are their areas of interest, and then also if you wanted to share the career coaching aspect that we have that is an opportunity for existing students and alumni in our program.
Sure. And as both Heidi and Dr. Hart mentioned, this is a generalist program, so we do not offer concentrations. And besides epidemiology and biostatistics, which are the quantitative aspects of public health, we will cover other areas like healthcare management, policy, leadership, and advocacy, environmental and global health. And then if you're interested in one of those fields and we would like to take it a little bit deeper, then we can help you pick electives, which you will have 3 electives to choose from, to concentrate in the specific area. So you create your own mini concentration. And you will also have personalized advising. So besides me you'll have me as a program advisor, you will be assigned a faculty advisor. And so Dr. Hart is one of them. And so if you're interested in epidemiology and biostatistics, I will be more than happy to assign Dr. Hart to you as your faculty advisor, so you can go to her for all the questions pertaining specifically to the field. So besides of the field advising, we provide you with personalized advising on, of course, your course planning, registration, any questions you might have about processes and policies at the university in general. We also have a career coach that helps our students with resume writing, cover letters, interviewing skills, even salary negotiations. And so we have created a large network of MPH alums, and I think our LinkedIn group is up to 150 students right now. And so it's amazing how they all connect with each other, and sometimes the students are from across the country, and we were able to connect students who are in the same state, for example. So they were really appreciative of that. And we do have students coming from different backgrounds: anthropology, nursing, some liberal arts. We have health science major now at UVM, so we're seeing students coming from there. Otherwise, there's no you don't need any prerequisites. Like Heidi said, you do have to be friendly with math and not to be afraid of it, and have a basic understanding of science before you jump into MPH. Otherwise, it can be for anybody, as long as you're enthusiastic and you're interested in it. We communicate with students mostly online and via phone. This program is entirely online and is offered asynchronously, which means you do work on your own time. You do not have to be logged in at a certain time of the day of the week. So that offers a lot of flexibility for most of the students who are working full time, have families and other obligations. And I have a scheduling. My appointments usually last about 30 minutes, and we can talk on MS Teams, Zoom, via phone. We can share screen, come up with a plan for you, and any other help you might need. And also you would be working with a career coach, and her name is Heather, and you will meet her during the orientation before you start MPH. And she will also be helping you with your applied practice experience at the end of the program.
Great. There's a lot that goes into the support for our students here. And I saw Tiffany did ask about the webinar recording. Kelly answered it on our side. Yes, we will absolutely share the recording out with everybody. So let's talk a little bit more about the Master Public Health Program. And Heidi referenced this, and I just wanted to come back and have Vicki share, what does that mean as a generalist program? And Vicki, maybe just explain that. And we don't need to go through all the different credits. You can see that on the screen. But just why do we prepare our graduates through a generalist program?
We chose to maintain our MPH as a generalist program because, and we kind of alluded to this throughout the discussion, that even if you're an epidemiologist, for example, you end up touching so many different parts of public health. And so we really want our graduates to leave the program with an understanding not just of a specific piece of public health, but how that piece touches the whole health system and how they can apply themselves, with skills in a certain area, but to other parts of the health system and creating healthy populations. So it was a very conscious decision to maintain a generalist program. We have areas of excellence that I think we'll talk to in another slide, but making sure that all of our graduates graduate with strong quantitative skills, with an understanding of health policy and law and ethics and social determinants of health, and some of the other key pieces of a public health degree that will allow them to go out and be useful participants in the public health world, and then can specialize in other areas, as they choose to, as their careers develop. But they'll have a core foundation.
Great. I think that's an important aspect to make sure that we're clear on. I wanted to pause for a moment, and I want to just let everyone know that we're going to show a video. It's about 2 minutes, so we'll come back after the video, so don't go away because we have a little bit more to talk about, and we want to make sure we get to your questions tonight too. But I wanted to share this new video that we have with one of our current post-bac students, public health students, and she really describes that experience of being online, independent, fitting it into your life, and the support that our faculty in this program and the field that she wants to focus in on in public health. So I'm going to have everybody turn off their cameras. We'll be right back, and we'll be back in about 2 minutes.
UVM does a lot more to consider the fact that the experiences of their public health students will be different. The field of public health that I'm most interested in is global health, and the way I got there was from my undergraduate studies in microbiology and immunology. One thing that attracted me to the online MPH program is the fact that I'm so independent. My schedule is pretty sporadic, so just knowing that I would have the flexibility to plan around that was great. I actually find that I have a better relationship with my professors at UVM, who are all online, than I ever had with any professors in my undergrad experience. The program does a really good job to make up for the non-traditional social aspects of learning. So there's a lot of discussion board and, using Microsoft Teams and Zoom and interacting with other students. So I think that's really unique. I think the school has done a great job adapting to those needs during a pandemic. It takes discipline, but I think it's so rewarding to be able to have the independence and the flexibility to live your life and also go to school and be a master's student. Here, they really care about their students, and I think especially coming from a public health discipline, in pandemic times especially, our professors have been extremely caring about what's going on in our lives, extremely accommodating, and letting us know too that, we're human beings as well. We're also struggling. The stress is not lost on us. We're here for you as your professors, but moreover, we're here for you as your colleagues and as your teammates, and we're here to support you and ensure your success.
Hopefully that gives everyone a little glimpse into what student life is like through our public health program and how incredible our faculty are. And that includes you, all three of you as well. So I just wanted to come back and offer up any questions that people may have. We'll have a few minutes here to answer those questions. If there's something that we didn't get to tonight or you had a question afterwards, we'll put up our email address into the chat box. And please do send us an email. We also have chat on our website that you can talk to our advisors in addition to email. So Vicki, you touched on this, and I think this is a great way, and Heidi referenced it too, that you have such a strong foundation of public health knowledge. And I can give an example too. I was interviewing a gentleman who's in our public health program, but he's on the path to becoming a doctor. And he really feels like public health is so important to his career as a physician. And because you're going to see and look at things through a different lens with the public health lens as a physician. So maybe just come back, Vicki, and talk about the importance of that foundational knowledge.
Yeah, absolutely. And I love that example because if nothing else, this pandemic has shown us the incredible ties between public health and clinical science, that one really can't function without the other. And that, for future clinicians, having a public health background is incredibly beneficial because really the two are so married together. As you can see on the slide that, we do offer a very core foundational generalist program, but there are certain areas in which if you are interested, like the student on the video was interested in global health, we offer electives in that area that, you can sort of pique your interest over to that side. Environmental health is very strong. We have classes on the public health impact of climate change, which is something that we're all going to be dealing with, whether we like it or not, over the next several years. And it's important to understand that and have people trained in what that's going to mean for the health of our populations, domestically and internationally as well. And then health leadership and policy and the quantitative public health sciences. And again, you have a core foundation, but then there's all kinds of different electives that can guide you down one of those paths if that's something that you're interested in. And I'll turn it over to Heidi just to talk a little bit about her public health surveillance course. It's one of our electives and how that marries into epidemiology, biostatistics, but also other areas of public health.
Yeah, thanks, Vicki. So I love my public health surveillance course, and it is a privilege for me to get to be working full-time in public health, but then also get to be a little bit academic and teach a course that I'm really passionate about. So that's my career development, right? My professional development as an ongoing learner and getting to contribute as part of the greater UVM learning community. My surveillance class was born out of a class I took 10 years ago and wanted to think about more. And it really is it's a peek into many different surveillance systems, whether that's the behavioral risk factor surveillance system that calls people on the phone and asks them about smoking and physical activity, or vital records, in my opinion, the single most important surveillance system we have. Are you born? Did you die? How? And so I cover a little bit of all the topics. And I think those data systems are what biostatisticians and epidemiologists build on. And so that's why it's a great complement to what Vicki was sharing about the other courses.
Great, thank you so much. And I want to maybe, Heidi, stick with you for just 1 second. There's a great question here as well. Norel says, I'm a clinical social worker and interested in public health. What steps can I take to get involved in careers related to public health and epidemiology?
Oh my gosh, that's such a great question. So I will share another bias of my own, which is that both mental health and other upstream determinants of health, such as poverty, education or lack thereof, racism, classism, sexism, are all things that we are talking about in a field of public health more than we ever have, and we still need to do more. But with that mindset, social work overlaps deeply with some of our public health strategies. And usually we think of social work and associated maybe interventions as a little bit more on that qualitative side, as opposed to the quantitative side of biostats and epi. But I think and I've seen in some of the work I've done with states across the country, that the planning for assessments, right, community health assessments that are really sort of grounded in looking at data that is both quantitative and qualitative. Social workers have been part of that at the community level for many years and can really provide valuable perspective, especially if you complement that with some biostats and epi coursework. I think you would bring the right questions to a community planning type effort. And that's just one example of how that qualitative and quantitative data can inform both whether it's community health assessments and improvement planning, or sort of more program specific planning and evaluation.
Great. Thank you so much for that question and that response. I wanted to come back to the next question. Vicki, let's answer this one, and then we'll get over back to Vika and have a little bit more of the logistics here, and then we'll come back and finish questions. But the question, I'm a pharmacist looking to learn more about public health. How can I augment my pharmacy knowledge with public health? What do you think, Dr. Hart?
Again, a fantastic question. And I love, hearing people who are in pharmacy backgrounds, clinical backgrounds, different medical fields, really taking an interest in public health. So it's a great question and really, really good to hear as well. I think one piece of this question is, where can I look to learn more about public health? If you're not ready to enroll in a degree program, there are some great online resources to learn just a little bit more about public health, and UVM has some of those. But I think to go off what Heidi was just saying as well, that there's areas in which pharmacy intersects with public health. And so seeking out those areas and individuals that you might know in your network in those areas, and finding out more about what they do and how they have pivoted, from maybe a pharmacy field into more of a public health related field. So I would, and this is something that I say to all my students who are interested in career advice, is looking in your network to figure out, who is doing the type of work that I'm interested in doing. And then spending some time talking to those individuals and finding out how can what I'm doing now pivot or intersect with what I'm really interested in learning more about or curious about.
Great, thank you. And thank you for that great question as well. Vika, I want to come back to you because these are the questions that you answer all the time with our prospective MPH students. So let's just touch on these briefly to make sure that we're answering these for any of our folks tonight.
Sure. So the program is very flexible and you can start at any point of the year. We accept applicants for summer, fall, or spring. So depending on when you start and how many courses you're able to take per semester, the length of your MPH tenure will depend on that. You can spend 15 months in the program at the shortest, and the most you can spend is 5 years. Most of the students who work full-time typically take 2 courses per semester and maybe 1 or 2 in the summer, and they're able to complete the program within 2.5 or 3 years. So it really depends on your situation and where you are. The tuition, we will have a slide with the exact amount for our students, but the out-of-state students pay differentiated tuition, which is a lot less than the regular UVM tuition. And the financial aid is available, and pretty much all graduate students who apply for federal loans get them, as far as I know. Unfortunately, we're not able to offer any assistantship or scholarships at this time directly from the program. Online courses, as I mentioned before, they are asynchronous, and Dr. Hart, feel free, and Heidi, help me here with more details about how you run your courses. But the students do work on their own time, and the instructors typically release the materials once a week, and then you do the work, you do the readings, maybe you watch videos. Not all instructors will have textbooks for their classes, and complete the assignments by a deadline. Dr. Hart, do you have anything to add to that, Heidi?
I think that covered it perfectly. So our courses are, as Vika said, structured so that you can do it on your own time according to your schedule. But we do have periodic, often weekly deadlines so that you have to keep up with the course as it's going through. You can't just do everything in the first 2 weeks and be done, or everything in the last 2 weeks and procrastinate. So we do try to keep you on track and in line with other students so that you're having a real learning experience alongside your peers.
Great.
Thank you.
And I know we've talked about this a little bit, Vika, too, just concentration or area of specialty. And then I know we also have a question about internships and fellowships that just came in as well.
Sure. There are no fellowships, but we do share any internship opportunities with our students if they come our way, be it from the Vermont Department of Health or elsewhere. And you will also have a small internship at the end of your program, which we call the Applied Practice Experience, where the students have to devote at least 20 hours in an organization of their choosing and work with our career coach on going through that process.
Great. Requirements. We've talked a little bit about having a passion for math, or maybe not passion, enthusiasm, I think is what Heidi said. Enthusiasm, passion might be a little overstated. We'll go with enthusiasm instead. And we also did have a question too. I wanted to just recognize that Eileen had said, I'm struggling with college statistics at the 100 level. Would it be impossible for me to pass the graduate level college statistics class? So Vika, maybe weave in a response with some of the admissions requirement.
Sure. We would probably look at your transcript as a whole. We won't focus on just if you get a bad grade in science or math. And we also accept students on conditions. So if you have very little or no background in math or statistics or sciences, we can accept you on condition that you get a B in epidemiology or biostatistics. And that way the condition will be removed. But Dr. Hart, maybe you'll be able to answer if you're familiar with the statistics courses at UVM. And if it's a 100 level course, I assume it's not calculus based and the students should be well prepared for biostats.
And I want to emphasize that we see students coming into the program from all different kinds of backgrounds. So not everybody's coming in from a math background. And we see students coming in, and this is often what I get before my intro biostats class, is students will email me and say, I'm a non-traditional student. I haven't sat in a classroom, let alone taken a statistics class in 25 years. Am I going to be okay? And what I usually tell them is we don't expect you to know statistics before we teach you statistics. We expect you to be able to be familiar with math, to have algebra background, to be able to, as Heidi said, have a willingness to jump in and try. But we don't expect you to know biostats before we teach you biostats. That's what the class is there for. And that's what our support system is there for. We just need to know that you have some enthusiasm to be there. And we've definitely had students, as Vika said, who've come in conditionally and have done just fine in biostatistics and epidemiology. Staying on top of the material is the key point, and learning as they go and asking for help when you need it. So as long as you're willing to do those things, I don't see any reason why you can't learn biostats. And I'll tell you one thing, my first statistics course in my undergrad, I hated, couldn't stand it, didn't want anything to do with statistics. And now I'm a biostatistician, so it can turn around.
That's good advice. Thank you. And I know we're kind of coming up on time. I want to be mindful of that. We're going to wrap up here in just a moment. So I just wanted to recognize some of the different steps that we have here for the application process. And all of this is on our website as well. And then Vika, do you want to just walk us through? I know you mentioned that you can start at any time, but there are some deadlines that we're trying to hit if you are indeed interested. And what is the accelerated MPH program as well?
Sure. So as you can see, we're now accepting applications for summer and fall, and you can start the summer classes by May 24th. For accelerated MPH students, so this is for UVM juniors who can apply for accelerated MPH and then take 3 public health courses during their senior year that will be applied towards MPH and both their undergraduate degree. So the deadline for those students to start in the summer is April 1st, and if they'd like to start in the fall, it's May 15th. As you can see, the tuition is $683 per credit for remote residents and $927 for out of state, and the financial aid is available, as I mentioned before.
Awesome. Thank you. What a great opportunity for juniors at UVM as well to get both degrees. That's so amazing. I wanted to come back and either Heidi or Vicki, whoever wants to answer this, but we have a question from Heidi. What are some examples of roles that the environmental scientist career includes? Are there opportunities for laboratory research within the umbrella of epidemiology and public health? I don't know who wants to take that one first.
I can let Vicki chime in, although I will say I am, as much of a generalist as I claim to be, I am not a lab person. Like pipettes are not my thing. So I will own that. But I do know many epidemiologists, and more so in the environmental health realm, who do a little bit more of a mixed sort of field work or lab related work connected to their epi. And toxicology is an important sort of science that supports environmental epi. And I think in addition to I'm thinking of my toxicologist friend right now who's running the vaccine call center, which again shows transferable skills. But I'm also thinking about so many of our climate change scientists who are working and can coordinate laboratory science with some of the more environmental work. But Vicki, happy to have you add to that.
Sure, and I'm wishing that another faculty member, Dr. Gleason, was in this call too, because Dr. Gleason is an environmental epidemiologist by training. So she has a real focus and expertise in that area. And I'm thinking of the research that she's doing that she's told me about, where she's working with ground wastewater and actually just got a new grant looking at indicators of COVID and vaccine and different things in ground wastewater that's allowing them to understand better the health of the population in different areas. So there's definitely applications on the laboratory side of environmental science with public health and understanding and improving population health with that. I can't speak to the lab side of it too much, but again, on the climate change piece, that's going to be a huge part of public health going forward. It's something that we can't avoid and shouldn't avoid. And so there will be a lot to understand with the impact of climate change on health of our populations around the world.
Great. Thank you both. And thank you for that great question as well, Heidi. Hopefully we've answered questions for you this evening. If there is something else that you are thinking about afterwards, please do chat with us on the website. Send us an email. Let us know if there's something that we can answer. But hopefully this has been an enlightening conversation about peeling back the layers, looking at epidemiology and biostatistics in terms of what it is, the training, and then the career opportunities. Thank you, everyone. Thank you, Vicki, Vika, Heidi. We really appreciate your time tonight and have a wonderful evening. We'll send out the recording in another week or so. Have a great night.